Okay guys, so the next step in being able to manage an airway is using nasopharyngeal airway, or commonly referred to as an NPA, which is this one here. Similar to what the OPA does, it's being able to maintain patency of the airway by going from the nose right down into the pharynx and behind the tongue. So if you have a patient that is unable to maintain their own airway and you choose to use this for whatever reason, this is the nasopharyngeal airway here. In particular, patients where you can't use an OPA, patients that have a lot of trauma to their face, their mouth, trismus patients, so their mouth is locked shut, we can actually utilize a nasopharyngeal airway. They're also quite well tolerated by patients with an intact gag reflex. So OPAs, if they've got a gag reflex, it will make them gag. These are normally pretty well tolerated, so you may actually be able to use this for a patient that does have that gag reflex intact. So these are a rubber plastic type of airway, similar to what the OPAs have. They have a flange on top and then the point down here. The difference with this one here is it actually has a what we call a bevel, so that 45-degree angle that sits down at the bottom of that. And it's important because we're going to use that bevel to correctly position in the nose before we actually insert that. Again, they come from different sizes, right down to little tiny infant airways, right through to quite a big adult patient as well. So again, you can see the size difference there. Just about making sure we actually size it up correctly. So for sizing up for your NPAs, we're going to use the tip of the nose or the septum of the nose to the earlobe. So similar to what we were doing before with the oropharyngeal airway, where we were going from the mouth to the ear, we're now going from the nose to the ear. So to measure it up, tip of the nose, right down through here. That one's a little bit too short. So let's try this one here. Bevel, down through there. Tip of the nose, right through to the earlobe here. So you can see that's the length of this one we're here. The difference with the nasopharyngeal airways as well is the width. As you can see here, so the actual hole in the middle is wider in the bigger airways, and that's because people's noses are a little bit bigger. The other thing we do have to do for these particular ones, because they are rubber plastic, inside the nose you've got a lot of mucous membranes. It's nice and sticky, so as we breathe in, it's designed to collect all the dust particles and foreign objects so it doesn't actually go down into the airway. So if we were to put that plastic rubber down through the nose now, it would actually stick a little bit. So for nasopharyngeal airways, we actually have to use a water-based lubricant to be able to assist in inserting these down. So there's single sachets, there's multiple different brands, it doesn't matter which one you use, just as long as it's a water-based lubricant that you can actually utilize for this patient. So for this patient here, you use this one here, open this up. Definitely wearing gloves, because we're now inserting this into the patient. We're using some lubrication, so make sure you get some gloves on. We're just going to place a little bit of lubrication on that airway, just like that. Now, when we're inserting these airways, we try and go down the patient's right nostril, and the reasons being it's normally a little bit bigger and a bit straighter than the left side. In saying that, if you're not able to use the right nostril, we can actually use the left. To insert these, what we need to do is find that bevel. So the pointy part of the bevel is going to be pointing outwards. So the short side of the bevel in towards the center of the nose, the septum of the nose. The long part of the bevel facing the outside of the patient. We're purely going to just pop it into the patient's nostril there. You may have to turn it slightly using the natural curvature of the patient's airway there, inserting down. And the flange will sit on the tip of the nose just like that there. So that there, now we're able to actually manage our patient's airway. You may even have an OPA in there if you're not able to manage it. You could have an oropharyngeal airway in, you could have 2 nasopharyngeal airways in if it got to the point of being able to effectively manage that airway. To pull these out, purely just pulling it out same way as it went in. Again, just to recap, lubricate this one up. Measuring from the tip of the nose, the septum of the nose, to the earlobe. Bevel, short side of the bevel towards the patient's center of the nose, long part outside of the patient. Pop it into the nose, slightly give it a twist. inserting there. Flange will sit on top of the patient's nose, and then we're actually now managing our patient's airway.